Unfortunately, with HSV blood tests, there is no real way to ever, for 100% fact, know which location you get each strain in. However, based on what we do know about herpes, it is safe to assume that HSV1 is most likely an oral infection and HSV2 is a genital. The reason why it is safe to assume that, especially with asymptomatic situations, is HSV2 very rarely lives in the mouth, and when it does, it usually causes really adverse symptoms. HSV2 also likes to live at the base of the spine, which is why HSV2 is mostly found below the belt. HSV1, most people have oral cold sores, which are HSV1, which is why it's safe to assume that you probably have oral HSV1 and genital HSV2. But like I said earlier in the video, there is no way to 100% know that for sure. The only good thing about being asymptomatic means that you are less contagious than someone who shows symptoms. You can still spread herpes during times of viral shedding when you don't have any signs or symptoms present, but people who are asymptomatic tend to virally shed less than people who have outbreaks. There are also some signs to look out for viral shedding. Some of those include lower back and leg pain, tingling sensation in your skin, and itchiness in your skin. Also, being you tested positive for herpes, you know that you have that virus in your system. Keep an eye out, especially below the belt, for any types of bumps that are unaccounted for, any type of pimples or heat rashes or anything like that, because herpes can be tricky and herpes can look like those things. And being you know that you technically have it, keep an eye out. It's better to be safe than sorry. Herpes usually lasts around 5 to 7 days. Heat rashes usually only last 1 to 2 days. And razor bumps usually last anywhere from a couple of hours to a day or two. So if it clears up in less than a day, you know it probably wasn't a herpes outbreak. If it's taking like over a week, that might be a herpes outbreak. Go get that looked at. And if at any point you do get one of those pimples or bumps or something down there that you feel is a little bit off, get to a doctor as soon as possible and get that swabbed, and maybe that can help answer your question, because the only way to know for sure whether or not you have herpes either orally or genitally is to get a herpes sore swabbed.